Extractions on mature skin can be very risky to the epidermis. The skin has thinned, the woman or the man is now a little bit older, the skin is drier. Make sure that if you are seeing a skin specialist and in the steps of the European facial, this person is doing the extractions, make sure that you are informing them of any skin tags and possibly any moles that may look a little unusual to them, so that they are aware not to dig so deeply into the epidermis. Also, when it comes to digging deeply into the epidermis to do extractions, the skin specialist is really not licensed in the state of Illinois to use any tools. If they are not aware of that, please make them aware. It is something that a lot of skin specialists, when they are taking their state exam, should be aware of. And I think many of them are not. And they're using tools on clients, 20, 30, 40 years old and 50-year-old patients, and they're doing some damage to the epidermis, causing broken capillaries. The other thing that I would love to address is the aggressiveness of skin specialists when it comes to, and doctors as well, when it comes to chemical peels and microdermabrasion treatments and being really aggressive with the skin. Vampire facials, photofacials, or IPLs, the constant scraping and peeling, burning and pulling of the skin for someone mature like myself is actually drying the epidermis out. The best thing that you could ever do for your skin is give it love and tender care. If you're keeping the skin highly hydrated and moisturized and making sure that you're using wonderful products, and later on we'll address products, if you're using those products and you're taking great care of the skin and only cleansing the skin at night, you're going to be okay with your skin. Everything is going to be absolutely fine. There's no reason to be so aggressive with the epidermis. Anything that you do for your face, also be sure that you're doing that for your neck as well. That's extremely important, that you give the neck as well as the face the same love and attention. That's very important, that the skin ages gracefully. So you want to make sure that you're doing the best for your skin, and aggressive treatments is just not the way to go. Now, a lot of skin specialists and doctors would probably disagree with me, but I'm in my 50s and I have never had a chemical peel. I don't do microdermabrasions on my skin. I am here to educate those that are like me at the same age in my demographic, and I want to make sure that they are doing the best possible things. Less is more, not more is more. Aging your skin will be one of the worst things that you could possibly do if you are being really aggressive and constantly having treatments and chemical peels and those sorts of things that can really dry the skin out even further. You're not going to look younger, you're going to actually look drier. Signs of aging will appear. You're going to have cracks in the skin, and cracks will turn into wrinkles. When it comes to exfoliation, that's the next thing that I would like to make sure that my demographic understand. Once a week is really all you need to do. A rice powder is wonderful for exfoliating the skin. Mix that with a little warm water, and that'll be beginning at the neck, your jaw, your cheeks, in between your eyes, the glabella. That's something that you want to make sure that you're doing in a very mild way. When you're working around the eyes, be very, very gentle. The skin around the eyes and the epidermis here is much, much thinner and much, much more delicate. So you want to be very tender with your skin. I would have to suggest also, if you are going to use something that has more of a granule to it, add a little baby wash, something that's very, very soft, and be gentle. You don't have to be aggressive with your skin. And again, once a week is all you would need to do for an exfoliation, no more than that. I don't think that it's necessary to use alcohol on the skin. that's any sort of toner. I'm sure that a lot of dermatologists and skin specialists would suggest that a toner is required, but why when you're in your 50s? We're already drying out. The more aggressive you are, the more you're cleansing the skin, the more that you're scraping, again, burning, peeling. You're not actually going to make yourself look younger. You're going to make yourself look drier and ashier and grayer. You want to make sure that you're keeping as much of your natural oils into your skin as possible. The oils are essential to looking youthful and looking healthy. So that's something you really need to be careful with as well. So the next thing that we'll talk about is going to be a dyeing art, and that is a secret that a lot of dermatologists and plastic surgeons and skin specialists, I might have to add, are really unaware of. And so this particular dyeing art is going to address the sagging of the skin, and I'm going to show you in a demonstration how to keep the muscles in the epidermis strong, tight, and firm. I'm going to show you how the skin can be lifted, increase fresh blood flow, circulation, and drain the lymph nodes. So I'm really excited about that. It is something that I'm extremely passionate about, and I think you're going to be very happy with this secret that a lot of people don't know about. So until then.